And welcome to week 10. This week is actually one of my favorite weeks. We're going to be focusing on the topic of phlebotomy, which I absolutely love. I don't want you guys to panic. I know some of you are really not looking forward to this section, but I promise you by the end you guys will feel very comfortable and you'll be okay with it. This week our focus is going to be on two chapters, and those are 47 and 44. For this day 1 video, I'm going to talk about chapter 47, and in the day 2 video, I'm going to talk about chapter 44. So chapter 47 is focused on phlebotomy and blood collection. You may hear me either say phlebotomy or venipuncture. They mean exactly the same thing. And what that means is it's a collection of blood through a tiny incision in the vein, and this is typically done with a hollow needle. So let's discuss your role as the medical assistant during this procedure. So your role will be to properly collect, label, and possibly process or store your specimen that you collect. In order to actually start performing phlebotomy, you need to have a basic understanding of a few things: your circulatory cardio system, the phlebotomy equipment you'll use, asepsis, and the venipuncture procedures. Now, several weeks back, we did talk about both medical and surgical asepsis, and you guys had some assignments in regards to those, so I'm not going to touch on that, but I will touch on the other three areas. So let's start with your circulatory system. So the circulatory system is important to understand because it involves the heart, the blood vessels, and blood itself. When we talk about the heart, the main job of your heart is to pump and to keep your blood flowing and moving. That happens with the help of blood vessels. So their job is really to provide that one-way travel route for your blood to go from the heart out to the body, then back to the heart. So when we talk about blood vessels, there are some really important key players that help with moving that blood along. The first one is your arteries. Arteries will carry blood away from your heart. And arteries, good to know their characteristics, because when you're drawing blood, you need to know if it's an artery or a vein. Arteries have a thick, elastic wall that feels very much like a rubber band, and the blood that they carry is a bright red blood. Arteries also have a pulse, which will pulsate the blood through, and that makes them pretty easy to distinguish from veins because they do not have that. After your arteries come capillaries, and capillaries really act as a gas station for your blood. The fuel or oxygen is delivered from your arterial blood to the cells, while the garbage or the carbon dioxide is removed from those cells and carried to the veins. So arteries flow to capillaries, capillaries flow to veins. Now veins carry blood back to the heart, but first it will need to be delivered to the lungs, where it will rid the carbon dioxide, because you breathe that out, and then a new supply of oxygen is breathed into the blood. It's also important that you know the characteristics of veins, because dealing with phlebotomy, you need to know what you're drawing from. So veins have a thinner wall and feel very spongy, very much like a bouncy ball, and the blood that's found in veins is a darker blood, and as opposed to the bright red blood of the arterial. Alright, so that's your circulatory system. Let's talk about some of the equipment that you'll need. So the equipment will vary based on what procedure you are actually performing, but most commonly you're going to need your blood collection tubes, your double-ended needles, tourniquets, tube holders, and syringes. So when we talk about your blood collection tubes, these may also be called evacuated tubes. They're designed to automatically draw the exact amount of blood that is needed to mix with the additive within the tube. Each tube is color-coded according to the anticoagulant or additive that is found within. And these can be plastic or glass, but as you well know, plastic is safer for not only the patients but medical assistants, and is really what is required from OSHA. Your double-edged needles are exactly what they sound like. It has two needles. One will puncture the skin, one will puncture a tube. What's really important for you to know is the general gauge size that we use. And for phlebotomy, it's anywhere from a 20 to a 21 gauge needle. Remember, the larger the gauge, the smaller the lumen, or the smaller the bevel. Tourniquets are elastic bands that are used to help us collect a sample. They get placed about 2 to 3 inches above the puncture site, and tourniquets in this manner can only stay on for about 1 minute in length. Any longer than that, and the tourniquet will actually start to cause the sample to break down and be inaccurate. Tourniquets are also placed tight enough to stop the venous blood flow, but still allow arterial blood flow to happen. A tube holder is a plastic device that is placed at one end of the double-sided needle, and really its job is to hold it all in place. And syringes, nothing really too new there. You guys have been playing with syringes already when we did injections. So what's important to know is for venipuncture, we typically use syringes anywhere from 5 milliliters to 20 milliliters. We will play with all of this equipment in the lab this week, so don't be too worried if you don't really understand what I'm saying. And the last part, let's talk about the good stuff, the actual procedure itself, the phlebotomy and the drawing of blood. So this procedure can be performed in several areas of the body, but the most common is going to be your antecubital space. And there are 3 main veins that we're going to draw from in this area. Now the antecubital space is that bend in your elbow, so right here, bend in your elbow, that's where we're drawing from. And we use the median cubital, the cephalic, or the basilic vein. The median cubital is going to be the most common because it's found right in the middle. The cephalic vein is on the outer edge or the thumb side of your antecubital space. And the basilic is found on the inner side or the pinky side of your antecubital space. So now we know where this procedure is going to take place. We know what we're using. Let's talk about the different methods that you can draw from. So there are 3 methods that we use in phlebotomy: the vacuum tube method, the butterfly method, and the syringe method. The most common that you're going to see is going to be the vacuum tube method or the evacuated tube method. And the reason is we can take multiple samples at one time using one needle stick instead of several. And just like I talked about when we talked about some of the equipment, that evacuated tube is going to only take as much blood as it needs for that sample and for that testing. Once that tube is full, it will actually stop filling. The butterfly method is also called a winged infusion method. And this is where the needle is attached to a thin tubing, about 6 to 12 inches, and then that tubing can either connect to an evacuated tube or a syringe. This method is really great because what it does is it allows more movement of the arm. It doesn't have to stay very stationary. So we use this for children or patients who have smaller veins. And the last method is the syringe method. The syringe method is set up very similar to that as if you were doing an injection or an immunization. We use this to collect samples from small, fragile veins that cannot withstand the pressure of the evacuated tube method. But there are some problems with this, mostly when it comes to how much you can draw. You are really limited to the amount of blood you can draw based on the syringes that we have available. So when you're using any of those three methods, it's really important that you know the correct order of draw and you follow it. The reason you want to follow the correct order of draw is to prevent any cross-contamination between the tubes or contamination with skin bacteria. So when you're drawing blood, the correct order of blood draw is a yellow top tube or a blood culture bottle, a light blue top tube, a red tube, a red marble or tiger top tube, a green, then light green, lavender, pink, white, or royal blue, gray, and then dark blue. Alright guys, that is kind of the big overview touches that I want to talk about for this chapter. Please read up on capillary punctures as well, as we will be doing some of those in class this week. And come ready to draw some blood. I really suggest eating before you come to class and making sure you're drinking plenty of water. This will help to not only plump up your veins, but it will also make it so you hopefully don't pass out on us. I look forward to exploring venipuncture with you guys and drawing some blood. Have a wonderful week, guys. Bye-bye.